One of the commonest difficulties we face as physicians is patients generally ask who can't fast during Ramadan. The answer to that is prepubertal children, menstruating women, pregnant women, breastfeeding women, people with sickness, and people who are travelers. They are exempted from fasting. Commonly, the surgical patients could be divided into emergency and an elective. During Ramadan, it's important to know we as clinicians face questions in terms of what are the common surgical complications presenting as an emergency to our department. There are several studies which show patients with known gastric acid disease can present with gastric acid perforation and the complications like bleeding, and patients with acute mesenteric ischemia, which is nothing but the blood supply to the bowel has been cut off. The other common surgical emergencies in terms of appendicitis, abscess, there is no significant change. In fact, gastric ulcer perforation has doubled if you look at few studies from 8% to 16%, where patients present with gastric ulcer perforation. Reason being, during the fasting long hours, you have increased gastric acid, and that can cause various physiological change in your parameters that can lead to a gastric perforation and also bleeding. How do we avoid these patients presenting to our hospital, especially in Ramadan? Is these people with known gastric acid disease can fast as long as they take their proton pump inhibitor during their Sahur and after breaking the fast at iftar. In terms of elective patients, I commonly get asked by patients is, can I postpone my operation in Ramadan? The answer is yes, and some people would like to get the operation done during Ramadan. They can have the operation during the Ramadan, depends on their individual symptoms, and obviously in Islam it does allow you to have your treatment during Ramadan, and once you get better after Ramadan they can still fast. During Ramadan, it's very important to make sure our diet is very well balanced in terms of carbohydrates, proteins and fat. It's very important to make sure our food is nutritious, which is easily digested and keeps you full and also keeps us well hydrated. There are certain foods like oatmeals, whole grain wheat, vegetables and fruits which are advisable. My advice would be to have a well-balanced diet and try and avoid overeating or overhydrating during Ramadan, and keep yourself engaged in spiritual activities, and it's important to self-reflect during the period of Ramadan. I wish you a very happy Ramadan. We take a pledge, we'll treat you well.